Before we get started, there have been some big news at DECODE, and so want to share that first and foremost. DECODE is now part of Unlock Health. And so as we look to what that means for our partners and the people we work with, it's really kind of adding an additional depth to our team, as well as rounding that out with services like managed care, and technology services, and partnering with Medicom and HealthAware. So if you hadn't seen the big news, wanted to kind of go ahead and share that as well. And then I'll turn it over to Josh to walk you through our first party data and some of the things that we found from there.
Great. Well, thank you, everyone, and thank you, Kathleen. I wanted to just start by introducing myself for those who I may not have had the privilege of meeting yet or working with, but I am Josh Snellgrove. I'm the Director of Strategy here at DECODE. My background, though, is on the client side in a variety of different health institutions and systems, everything from kind of community-based hospitals all the way up to academic medical centers, and even internationally, with my last post being with the Cleveland Clinic in Abu Dhabi. So really been able to see healthcare from all different sides, for-profit, not-for-profit, faith-based, and everything else. So, you know, I was flattered that Kathleen would ask me, what we're going to be presenting today is something that I personally struggled with whenever I was in healthcare marketing. And it was all about being able to look at our patients as people and capture some of those non-clinical moments along the wellness journey, or what we like to call the consumer wellness journey. Some of those, the entire 365 days of someone's life, rather than just the 10 sick days that they have. So we always start with a quote, and we wanted to bring something forward that would kind of center ourselves in the reasoning of what we're trying to do today. So we have here, friends are as companions on a journey who ought to aid each other to persevere in the road to a happier, or as I like to think, a healthier life in this case as well. So the whole reason behind the program that we put together today around the journey to advanced specialty care and really capturing some things beyond just a primary care referral, again, goes back to my own personal experience for about 14 or 15 years on the health system side, and trying to figure out, how do I put together all of the data that I have, whether it's a small study that I had done myself, whether it was things I was hearing from finance or strategy data, or just conversations with physicians or other clinical leadership or C-suite members around the system as far as goals, information, hearsay at times as well. How did I put all of that together to really make an effective patient journey and really map those journeys into something that was worth my time investment in doing it? I know that everybody has 1,000 things during the day and a million requests that you're having to field. So really want to show the value today of putting all those pieces together, taking and setting aside the time. And we put it all together in a very convenient framework. I'm going to share that with you at the end and really walk through a CV patient journey and look at the entire CV service line and really take us through that. But some of the things we're going to be looking at today is, Kathleen mentioned, we did some quick data, that a survey of about 300 folks that is going to help us see what are patients saying about how they choose a primary care doctor, and then how do they follow that journey over to selecting an advanced specialty care provider. Also, what do they want to see as a part of that journey? What touch points, what type of content, those different types of things. Then really defining that patient journey. What are those particular key elements and key areas that we really need to dig into? And then take that over into a structure and strategy that provides, again, a way to bring all this information together in a very meaningful way. And then how do we actually bring this to life into a patient journey map? How do we actually capture those moments that are going to make a difference and resonate with the folks under the service line, subservice, program, condition, whatever we're trying to achieve or solve? How do we bring that all to life in a way that's going to actually produce tangible results? So then at the end, we'll try to leave some time for question and answer. So be sure to jot down any questions that you might have along the way. And we will be sure to get those answered at the end. So the first part that we're going to jump into, as I mentioned, are what are patients saying? What are those decision drivers? Again, I mentioned that the purpose behind the survey that we did was to about 300 people. Now, I will tell you, these were non-healthcare people. So we actually excluded anyone that was in healthcare because we really wanted to get a good sampling of folks that may not have the same level of healthcare literacy, may not be as familiar with patient journeys and those different types of things. And what we did was we wanted to understand that journey, but then also create audience personas, not just necessarily look at what a respondent said, but what does it tell us about them based on who they are with our list of variables? So looking at gender, age, household income, education, ethnicity, and race, so that we can then start to build personas and look at the way that people are responding. So it becomes more behavioral rather than simply a response of a certain number. So one of the first questions that we asked for, and we really layered this in, we wanted to start with primary care because obviously we have to get those people in the door, have them have their screenings, and get that initial diagnosis to even begin the path over to advanced specialty care. So we felt like it was very important for us to understand what those patients are looking for in a PCP. Well, 50% of those respondents listed trust, transparency, and likability as the most important factors whenever they selected that provider. Now, when they had selected that provider, they also, about a third of our group also said that affiliation with a major hospital or health system was extremely important. Now, as you can imagine, this also tracked with an older audience that really felt like that was very important because of the fact that they may need to access acute services more often than some of the younger demographics. So we did see a correlation between the selection of that provider and then their association with a larger health system. About 76% of the respondents who prioritized gender when choosing a primary care were women. So obviously we want to make sure that people are feeling comfortable in that space. We know the difference between an ambulatory and an acute setting. So in a clinic setting, it's much more about that relationship versus the more transactional nature of hospital services. So it's super important for these audiences to feel very comfortable. And of course, I skipped over the 60%, but obviously ease of access, making sure that people are able to easily schedule, get those online appointments, same day availability, and everything in between to meet their own specific and individual needs there as well. Now, a lot of this may not come as a surprise to you, but the important piece here is that we have this data to really start to validate and construct that initial strategy. You know, a lot of times we do what's always worked or what's always been in the market, but I think we can all agree that COVID really threw a wrench in that post-COVID behaviors and the way that people felt or wanted to access care or be dealt with has really shifted and really changed. We talked a lot about consumerism in the last 10 to 15 years of healthcare, but it even took even more of a precedence whenever it came to COVID due to safety concerns and really wanted to be treated, you know, where things matter, where people's priorities are. They want to be heard, they want to feel comfortable, and they want to feel safe. So they really look for that relationship to build with their primary care physician.
And I think one thing to add here in terms of you're like, hey, I signed up for an advanced specialty care webinar. Why are we talking so much about PCP? And I think one of the core things that we wanted to prove to ourselves in looking at this data set was as marketers and people who have had a lot of experience in the healthcare world, we see these as two very different patient flows, right? But do our consumers think that way too? And so part of the reason why we asked some of these questions was to really get a baseline and understanding, are consumers looking at PCP and advanced specialty differently? And are the things that drive the decision-making for primary care different than the things that drive the decision-making and who they ultimately select from an advanced specialty? And the data says yes. And so we really kind of set this up to kind of really speak to kind of, okay, we did look at this and see if there is a variation. And I think what Josh is going to share on some of that advanced specialty care is really insightful when you think about it in context of the juxtaposition to primary care.
Absolutely, and that's a perfect lead up for the next bit here, where we're going to just talk a little bit more about what are patients looking for in that specialist. And this is where you'll start to see a little bit of a deviation that Kathleen mentioned from what's important whenever they get to the higher level of care, higher acuity there. Obviously, the number one thing, or 78%, I can't say the number one, but it's 78%, we're really looking to see if their insurance was covered. Again, should not come as a big surprise. People want to make sure that they're able to afford the care that they need and that their provider is in network. The second piece here, though, is really around those advanced certifications, making sure that that provider is qualified, that they're able to participate in that subspecialty or specialty for which they're needing care. The third piece here is really prioritize the provider's association with a major hospital. Usually along with the advanced specialty care journey comes some form of obviously a procedure, a surgery, or some sort of treatment that would be required at another type of facility. So really making sure that the person is connected there is of super importance to them. Now, the one thing that you'll notice here, as opposed to the primary care, is that trust and transparency is not as important necessarily. It doesn't mean it doesn't matter at all, or that, you know, those types of things won't play on the emotional side. But when it comes to selecting that advanced care provider, folks are really looking more so for the cost of it, as well as the qualifications and the affiliations are of much more important. A couple of other, oh, go ahead, Kathleen.
And I was gonna say, one of the things that was really interesting when we looked at the data, right? When I was, I've always learned that, insurance is a big primary driver for all decision-making for healthcare across primary care and advanced specialty. And we've talked a lot about gender, especially in primary care, in particular. But the two things I thought were really interesting, and when you dig into it and you think about it a little bit more, it does resonate, right? Yes, it's important for insurance to carry kind of insurance coverage for primary care decision-making. But one of the things that we found is on the advanced specialty side, they're more cautious of it because a lot of wellness visits are covered regardless, and the cost is less impactful than on the advanced specialty side. And so when you think about, and I know as a healthcare marketer and those who work in physician groups or hospital enterprises, like the insurance accepted list is probably the most painful thing to kind of get accurate data on. But it is actually more important for your advanced specialists to have that information than some of your primary care. Now, would it be nice around the, across the board to have it all there? But it is something that was really insightful that we kind of pulled out of that. And something obviously that you're seeing that more skilled expertise that is more important for those consumers.
Absolutely. So then when we looked at attending visits, this is another piece that, again, I talked about COVID, post-COVID, and we saw that rapid digital transformation where we started to offer those a lot more virtual visits and things like that. But interestingly, 61% of our respondents here really still prefer to go see their specialist in person. Again, it underscores the ability to make sure that operationally, that as we start to look at these patient journeys, that we're able to accommodate this. When we think about capacity with certain service lines and programs, these folks are wanting to get in front of that provider. So making sure that we're picking up the phone, making those appointments, or offering them online and having slots that are open for people to actually come in-house for this particular part of the journey is extremely important.
Yeah, and I think some of these stats there on hybrid, I think in kind of exclusivity, it's not surprising that as acuity increases, people are preferring more in person. I think one of the interesting things here is this hybrid model, and I think there's a huge opportunity for physician groups and hospitals to really look at how can you decrease, whether it's with staffing constraints and things of that nature, how can you help offload some burden from the physicians themselves and leverage, whether it's nurse practitioners or things of that nature, to do virtual intake appointments that help the patient feel more that you're getting to them quicker, ordering some of those labs before they actually get in to see that specialist doctor in person. And so I do think there's a huge opportunity for health systems and physician groups to really lean into that hybrid model in the specialty area.
One of the biggest facts that we found out of all of this is that basically 3 out of 4 folks within our survey said that they do independent research on their specialists even after receiving that referral from their primary care doctor. So again, while they look to trust their primary care doctor, the patients are looking to trust that primary care doctor, they're still going to do their own research. They're still going to get on the internet. They're still going to be going and looking at reviews and other areas to be able to do that. Which really led us to this aha moment that, referrals are no longer a closed path. It's not a given that a patient is going to necessarily go exactly where the primary care doctor is sending them. It's no slight on that doctor, but due to rapid digital transformation, transparency of information on the web, again, the rise in reviews, people want to know that they're making the right choice and that they actually have a choice. They want to be more involved in their care. And so by being active participants in their own care path, AKA going and looking for information about the doctor that they might have been referred to or researching others, is super important. But there's also some good news here. We have the opportunity to really acquire those patients, even if they weren't referred to us. So it's not just a little black cloud over our primary care practices, but this is actually an opportunity across the marketplace to actually give usable information if we understand what patients need, what they're looking for and where they want to find that, and we're able to easily connect them to that, it actually presents an open field for us to go and acquire more patients than what we have today through the referral process.
And I think it's so true, right? Josh mentioned, there's an opportunity for us to acquire patients that haven't been referred to us. But I also think this is a great opportunity when you think about your marketing strategy for advanced specialty care. It's not only important to get those patients that maybe were not initially referred to you by their primary care, but also to reinforce those your own primary care that are self-referring into your specialists. Hey, coverage on that so that you don't get a competitor sweeping in and taking those leads as well. So it's kind of twofold, kind of adding to the stack and then protecting kind of your key patient demographics that you're going to hopefully have from a network integrity perspective.
So now that we know these facts, and now that we've kind of gone through some of this information, it's really time to kind of connect some of those dots from the data to what patients actually want to see. So we've heard about some of their behaviors and what they do there, but we wanted to really dig down into who these people are, and what really impacts some of their priorities, and where could we start to build personas based on this, because that's the biggest part. We have to know who our patients are to even begin mapping the patient journey. So it's a very key and vital part of the process. Interestingly, men and women gave equally low importance to the gender and ethnicity of their specialists, really leaning more, again, on the advanced certifications, wanting to know if those providers are truly qualified, looking at other sources online. Are they published? Are they providing additional clinical thought leadership in areas of conditions, specialties, programs, their job, what they're actually doing? Women are more likely than men to research more than 12 specialists. And this is very interesting as well, because we really know that women tend to be the chief healthcare officers of the family. They tend to help make decisions, whether it's for their own children, whether they're adult children of their parents, trying to help them decide in an older demographic. So this really shouldn't come as a surprise to us. We've known that for quite a long time that is the case. And so really understanding, though, the amount of research that's done really makes us think about where we should be present and what type of information we should be providing, knowing that this much research is going into this process. The other piece of this as well is that the older demographic, when it comes to age, so we think about that Medicare audience, the 65 plus, typically do not actually do or conduct additional research on their providers, and they will go ahead with that PCP recommendation. And we saw this on the first slide with the primary care provider of usually the older demographic going more with what their trusted provider is going to offer them. Now, this is as opposed to that 35 to 44 range, where actually only 18% don't do additional research. So that really leaves about that 82% mark that are doing additional research. They're looking for resources and reasons why to choose that particular provider for which they received the referral, or another provider that could actually outdo or better meet their needs along their healthcare journey.
And I think one interesting thing, and I think this is a huge opportunity for anybody in the healthcare marketing space, is when you look at that 35 to 44 age range and knowing that 20%, they're only taking, they're abiding by that 100% referral 20% of the time, is really, if you're able to get those individuals in those age ranges are oftentimes getting exposed to a specialist for the first time. And if you're able to get that specialist appointment within your network, the integrity and the long-term lifetime value of those are extremely high. And so it's, some of the things that we're seeing from this research is maybe an opportunity to focus on that, what I'll call younger demographic, that 35 to 44, and making sure that you're kind of getting that first specialist appointment within your system. Because one of the things that we did find is there is this push to do additional research for specialists when we're getting referrals from primary care, but specialist to specialist, there is a little bit more weight there. And so that is something to consider when you're looking at your strategy and certain service lines, is how to reach that younger demographic that could have a much larger lifetime value.
And I should have said at the beginning, we actually have 2 different case studies in which we break down into this information a lot more. So we may not read every single word and every single stat, but just know as a follow-up to today's call, I believe that we'll be sending those out for you to be able to access and really dig into the information Kathleen, as you can tell, Kathleen and I will happily nerd out on any of the information in this presentation or others at any point in time. But we're going to keep moving through this to really go ahead and start to connect the dots into the actual journey mapping, because we know that that's of great interest to most of the people here today. So really, once we have all that information, we kind of boiled it down into what does this all mean? What do they actually want to see? And it's all about building trust and really that preference, but it looks different for the advanced specialty care. The number one thing that we've seen are really those advanced certifications. It's their educational background. I mentioned earlier, are they being published? Do they do research? Are they often offering clinical trials? Anywhere that they can show that they are an active participant in that specialty or in continuing education in that specialty is really important to this audience. The other piece is obviously digestible informational resources. We want to make sure that where people are looking, they have the information in a format that they want to receive that. So understanding the age, the demographic factors, and really able to meet those needs and produce the resources that are required is super important along this journey as well. Positive reviews. I know that this is a challenge, kind of the world over for everybody, of how do you garner those reviews? How do you combat some of the negative ones? But really, this is a focus area of this audience whenever they are looking at and weighing their options. But again, because they're doing online research, there is a lot of opportunities if we're providing those informational resources in a really good way that we can easily make up for some of those, some of the things that may not be as pleasant on the review side as well. Post-treatment attention. This is something that I think is really important when we talk about the continuum of care, and really making sure that where we are able to offer care all the way from initial diagnosis through rehabilitation, survivorship, or whatever that may look like for that particular service line. 70% of patients gave primary importance to finding quality post-treatment coordinated care and a coordinated care team. So really making sure that people understand that we work together, that our system specialists work directly with the rest of the care team and will stay in constant contact. It may seem like a kind of a cliche way of where we say a comprehensive network or continuum of care, but it is important to our consumer audience, and we shouldn't leave that behind. And then, of course, earlier we talked about ease of accessibility, so friction-free scheduling, making it super easy along that specialty care journey to get in touch with that particular provider or the office, and then being able to make that appointment. Allowing them to kind of ease their nerves and calm their worries whenever it comes to having to wait forever to get in with somebody, but really making sure that we're working together to deliver on the promise of getting people into that particular specialist, and that we make it as easy as possible.
And I think part of that frictionless or friction-free scheduling really ties into the need for referrals. And we've seen health systems really excel in this. And when they're able to say, okay, hey, do you have a physician referral? And if the answer is no, here's some paperwork to get your PCP to sign. If you do not have a PCP, here's a PCP that we can refer you to. And I think that is a key part in terms of helping them navigate kind of the complexities of something like this, which is pretty innate to individuals who've worked in the system for years. But the health system overall to the average consumer is very complicated. And so anything that you guys can do to kind of help reduce that friction has shown to pay out in folds.
Great. So Kathleen and I have talked about a lot of different things, but kind of now what? That's great. That's all good information, but how do we actually turn this into something that's going to help you or your department or your health system really put this together in a way that makes the best use of your time and resources and produces and delivers a tangible result for you? How do we actually deliver on this in a meaningful way? So this leads us to really defining this patient journey. So this is all about us putting up the markers that are important to people. Now, I mentioned earlier that we at DECODE believe in this idea of the consumer wellness journey. We believe in supporting people 365 days a year because that's all a part of your healthcare. We believe that it's not just about the maybe 10 sick days or the one emergency room visit that you have, that there's a lot of other opportunities for us to connect. But as a part of that, it requires us to realize that every patient is on their own journey. However, if we do this correctly, and if we look at all these different factors and the facts that we've been talking about, we generally know the paths that these folks are on. But we have to remember that this is like a layered oil painting. And you'll notice this picture here that I put to the left. And you can put in the chat or in the comments how many faces you see here. But we have to remember that there is a bigger picture, but it may look different for every single person. People may pick up on one piece of the picture, and that's what's important to them. So we have to have an ability to have different touch points towards different audiences through different approaches to really meet their needs and bring them into the fold and make sure that their healthcare needs are being met. So again, I mentioned at the top of the presentation that we were going to be digging in on the cardiovascular patient journey. And so really looking at it comprehensively as an overall service line. Now, the framework and approach that you're going to see from us today and that we'll share with you after the call really allows you to do this for a general service line, a large kind of big picture, all the way down into a specialty, a subspecialty, or a subspecialty of a subspecialty, really making it easy to think through and to meet the need or meet the goal that you're being asked to with your particular KPIs or requests from providers, C-suite, or wherever they're coming from. So we really divided CV up into the patient journey. And keep in mind, these tent poles are between ambulatory and acute side of the house, the kind of specialized centers of excellence. So our first stop is going to be really this idea of general awareness and at risk. So these are folks that may not know what they don't know. They may not know that they're at risk. They may not even know what a risk factor is. But this is our ability to connect with them on the ambulatory side of the continuum to really raise awareness and bring them into the fold through education. We then will put up kind of our second tent pole around chronic conditions. So these are folks that may be either symptomatic but haven't been diagnosed yet, or those who have been diagnosed and are required to have regular visits and regular care and regular maintenance of that particular healthcare condition. The third one here is around emergency or emergent care and the cath lab. So think chest pain, think stroke, these different things where people might be coming in with a heart attack and then have an immediate need for care, which could then potentially lead to our fourth tent pole here, which is surgery and of course cardiac rehabilitation. So anything from maybe a valve replacement to open heart surgery and everything in between that really gets down into the nitty-gritty of the specialized acute care side of the house. So then what we want to do is, now that we've really defined those areas of the patient journey, we really have to put it into this roadmap, into this structure and strategy. And honestly, we want to make sure that what we're doing makes sense and that we have a methodical approach to all of this, because it really is essential for us to do effective patient acquisition. We really have to be able to target the right message to the right person at the right time in the right channel. So we have to have that roadmap. We have to really understand where our true north is and our starting point, and then really follow these steps to have an effective journey. So there's 5 main areas that we recommend that you look at and that you really bring yourself into an understanding of. And the first one is understanding those service line treatments and offerings. You know, it may seem fairly rudimentary or kind of elementary, and you say, oh, I know what my service lines are, but you know, really taking the time to sit and look through, what are we offering? What services are relevant to the audience at that time? Making sure we understand what related conditions might fall underneath those particular treatments and offerings that we have. Also, new services, familiarizing ourselves so that we're able to chat more broadly about this and really look for unique ways to connect people to those service line treatments and offerings. The second one, and I just mentioned this a little bit, are knowing the conditions that the patients will come in with. It's really important to understand what providers care for what types of conditions and how we can then connect that. Sometimes this means very unique messaging to an audience that might be having a certain set of symptoms. It might be directly related to a series of ICD-10 codes, pulling that data and understanding what maybe somebody comes in with a false symptom, what they think is something else, but is actually related to that condition. There's lots of ways to really understand and have that opportunity, but really documenting that, being sure to follow through and making that a part of this patient journey. The third one is really diving into the patient mindset. And I know we always say, think patients first or provide patient-centric care, but are we truly sitting down and writing out or thinking through what would a patient actually say? Not what we want them to do, not the steps we want them to take, but what are they actually feeling? This may require us to actually go before they were symptomatic or when they're symptomatic and they haven't sought out care yet, all the way to the hopes, fears, and concerns that they may have when it comes to receiving treatment or seeking out treatment. Once we do that, we can then establish how we connect the way that they're feeling with what we want them to do. That means we need to define some goals. We need to be sure that we have very clear and direct and intentional calls to actions and drivers. Where are we sending these people? Is it going to be a phone call based on an older audience? Is it going to be something that requires an intro video or some other form of rich content asset that we know that a younger demographic would particularly enjoy receiving? So really making sure that we're aligning those, and not just aligning them with what we're trying to push for that month, but with what the patient actually expects and what's best for what we know about them as a persona and as a group. And then once we have those major strategic things done, we then move into what I like to call tacticville. So defining how we're going to reach that audience. Once we have that solid strategic foundation and we understand everything there is to know about what we can offer, what they're actually looking for, we then connect that to the tactics. That right medium really does matter as much as the message, and that targeted message to the right group. We don't want to, we have limited resources. I don't think anyone would raise their hand and say that they have an overabundance. So we want to make sure that where we're putting our time, our effort, and of course, our spend is really being used in the best possible way. So that's what this patient journey map really offers us, is the opportunity to be able to put all of this together from a strategic foundation, and it directly impacts the way that we go, and then hopefully allows us to track, analyze, and optimize on the back end for if our efforts are working or not. So we're finally at the moment that I think everybody has been waiting for, which is really to walk through the framework that we have developed, putting all of these different pieces together, those 5 elements across these 4 pillars of the CV service line. So what you're going to see, again, we're going to provide this to everybody after the call today to give you this template. And again, you can erase out the CV universe and put in any service line, any particular problem that you're trying to solve by going through here. But as I mentioned before, we're talking from the ambulatory side of the house. If we think about it linearly, from the ambulatory side of the house all the way over to our specialized centers of excellence on the acute side. We really start with this bucket of general awareness and at risk. And what I've done under each one of these is really define what goes there. What are the specific conditions or the treatments or the programs that live under each one of these? So under general awareness, it can be pre-hypertensive, high cholesterol, pre and diagnosed diabetes for people that may not necessarily know how to care for themselves or are new to the disease, any sort of screening that might happen here. But this is really where we use that service line awareness, heart health education, and things like HRAs. HRAs can be a very, very powerful tool to really pull over the audience from a place where they are unaware, really over into a cycle with us through CRM and other things where we start to help diagnose, screen, and really show them what's clinically appropriate from them if they simply schedule that heart healthy checkup.
And I think what's important there in twofolds, right? In a kind of competitive market, right? In a lot of these for our clients, right? They're new individuals, new organizations coming into the space, whether it's Amazon, the grocery stores, things of that nature, right? So the competition's getting even further. And what we're seeing with some of these advanced specialty care opportunities is an importance on moving up the funnel to this education piece. And this is where those HRAs really can be beneficial in 2 ways. And first, kind of helping you identify and having people self-select and have you be part of the consideration set. Part of the data point that you'll see, or that you saw earlier, was, on average, they're looking at 2 specialists. And so how do you make sure you're one of those 2 that are part of the consideration set? Part of that's the education and the HRA piece. And I think there's another huge added benefit when we talk about privacy and security and things of that nature, and the value of building your own first party data. And so when we talk about HRAs, I think there's so much value there in several different ways in terms of making sure you're being part of that consideration set, moving up that funnel, and then also helping to build that first party data that can be utilized down the road.
Absolutely. And really the HRAs, as Kathleen said, are super important in this particular phase, because as we progress along this kind of continuum of care, we're able to start getting some of that data from in-house, because these folks have actually had encounters, have actually completed those appointments, and we're able to pull over and really start to look at propensity modeling. We're able to use those ICD-10 or procedure codes to start looking at these groups to say, okay, we know that this is the particular type of population that would need this particular type of care. So I'm not going to go necessarily through each one of these, but as you can see, chronic conditions are things like, diabetes, hypertension, even over into the more serious conditions, potentially like congestive heart failure, cardiac rehab, where people are needing to be seen multiple times on a regular basis. Again, I'm not going to go through each one of these, but then what we do is we move it down into how does this translate into clinical care? Who are those people or specialty providers, or even a PCP or an emergency room physician that are going to need to be a part of this journey and a part of this path? This not only helps us understand who we can go and talk to for more information, but it also gives us the opportunity to look for cross-promotional opportunities. So really being able to connect the dots across our health system and start to connect other specialties that may overlap. A lot of these tent poles that we have up here, while they look separate in these boxes, a lot of them will overlap. People will also maybe start in an emergency setting after a heart attack, require some form of surgery, and end up back with a chronic condition. So just because we have it on a linear from that ambulatory to acute side of the house, please know that a lot of this is fluid from the perspective that patients can move around along this journey and sometimes end up back into kind of more of that educational and resource portion of this patient journey as well. So when we look at this, for example, we talk about even in clinical care for cath lab and emergent, we even bring EMS to the table. EMS communication and EMS relationships where you're able to impact those. I know that those relationships are different across the country, but where you're able to impact those, bringing those particular stakeholders to the table and really helping educate them as providers is also an equally important piece of this when it comes to that clinical care.
And we've seen a lot I was going to say, we've seen a lot of success in kind of doing this outreach through EMS in certain markets where it's available, and helping influence by educating, door to balloon time, things of that nature, and really helping influence some of those patterns and some of those referral patterns. So one of the things, that we really think is important is looking at, we talked a lot about, 3 out of 4 patients are looking outside of their direct referrals, but we also know that that is still a good portion of what influences specialty care. And so making sure that our marketing strategy and media reflect that, and we have segmented messages for those audiences as well that might influence the referral patterns.
Absolutely. And you'll notice by this point that we have actually completed the first 2 portions of our mastering the patient journey list. So we've really looked at what are the services, treatments, and programs, and really who is helping to care for those particular conditions. So then we move into kind of that third step of the journey, which is really understanding the patient mindset. So really, what are our patients or the consumer, if they're not a patient of ours yet, really thinking at each of these moments? This is where we boil it down and get real. This is where we get the emotional side of things, and we really think like a person, not necessarily what we want them to do as a healthcare provider. So for general awareness of risk, it's really that I don't notice anything physically wrong, but I guess I might be at risk. Again, it puts you in the mindset of folks that just may not know what they don't know, or may not care. They're healthy, they haven't had any issues. Why should I care? The second, chronic conditions, is really something feels wrong to me and I'm seeking care, or they're actively having that care for their chronic condition. Obviously with the cath lab, I have an immediate heart care need. And then for CV surgery, I need that CV surgery or highly specialized care. Again, it may seem a little bit basic, but it's very important to really recenter ourselves in those patient expectations and what they're thinking about in those moments to be able to connect them to the right driver and the right call to action as well.
And I think this is important. We talked about the convenience and reducing friction from a patient perspective, whether it's scheduling or getting in. And I think when you look at this, right, you have a lot more opportunity to have potentially a 2 to 3 week, 4 week wait on maybe a chronic condition. But when it comes to more CV surgery or cath lab situations, there is a precedence put more maybe on the operational side in terms of how do you get people in faster, because that is one of the key things that's driving their selection process.
So then once we have all of that information kind of down, what we wanted to do is we wanted to try to figure out what we are trying to do for our patients. We then will actually attach that to a particular tone and then a key point of message. So the reasoning behind this is really to start look at our targeted messaging. And we want to make sure that we're splitting that between the ambulatory and acute side of the house. I mentioned earlier, the reason that we do this is the relationship between a physician in a clinic setting is very, very different than somebody who goes in for diagnostic imaging, a one-time procedure, or some other form of hospital-based care. While it's important for those folks to have a great relationship and a great experience with their providers while they're in the facility, There's a much more long-term relationship usually in the clinic setting. And as the research showed us in the very beginning, that trust, the likability, and those different things that really come along with that relationship are much more important for the primary care setting and that more ambulatory setting than it is really in the acute setting to our consumers. So for our first bucket of that general at risk, what are we trying to do for our patients? Well, we want to build those organic long-term patient relationships through education. We mentioned the HRAs. We talked about other sorts of resources and educational places as well. This is where we really would see that maybe Heart Month style promotion, advertising, things like that. For the chronic conditions portion of this, it's really resource touch points along that patient journey to sustained wellness. It gives us the opportunity to build that loyalty, to build that relationship once that person is a patient, and then they start to trust us for the clinical advice that we give. Now you'll notice that we also, again, I mentioned the tone between ambulatory and acute. And really on the ambulatory side for the chronic conditions, it's all about being personal, having that support system that you need, knowing that you can call that doctor's office and that they will get back to you within a timely manner to give you what you need. Improving health together, walking along that healthcare journey together, and that you're in it for the long haul. On the acute side, this switches a little bit for the tone because, again, you're not going to call the hospital every day for that day-to-day support that you need. It's really more that public service announcement. It's raising awareness at this point, really the comprehensive continuum of care, really allowing people to know that you offer providers all the way from that primary care side of the house over to the specialized centers of excellence. And then, of course, expert advice whenever you need it. Now, what we do is we then turn these different tones and what we want them to do into a key message. So how do we put all of this together, understanding the mindset, what do we need them to do, and then what is that tone that guides us? So the key point of the message here is for education and awareness is heart health education and service line awareness to address issues before they start. We obviously want to help people stay well. So as a portion of that, we have to make sure that they understand what they might be at risk for and how they can take care of that. For the chronic condition, it's from initial diagnosis to maintaining your overall wellness. We're here for ongoing specialized support for every step along your journey, all the way over to our surgical portion and rehab, which is our experts and highly specialized programs give you confidence to face your diagnosis and empower decisions, focusing less on worry and more on recovery. And as you can start to see, this really helps us not try to make one particular print ad for one particular condition be all things to all people. We're not trying to shoehorn all of CV services, the very diverse universe of cardiovascular care, into one print ad or into one social post. This gives us the opportunity to see where we need to target and what mediums we need to use in order to be able to do that. I can tell you that with my limited resources, when I was on the healthcare or on the health system side, I was very guilty of that, of not taking the time to really look at this and say, I need to get CV volume. We've got to get an impactful message out there that will cast that wide net and get as many kind of heads in beds as we can. And so really understanding these nuances and the value that I have seen in the strategies that we're using here every day at DECODE is really what's driving better results and better use of those resources along the journey. So we then move that down into the call to action driver. Now that we have that kind of key message or the key point of the message of what we're trying to do, we then roll that out into actual calls to action. Now, you'll see some similarities here, right? There's slight nuances, though, between the ambulatory, where it's really coming from that provider, whereas the acute comes more from the facility. It's more of that PSA style, whereas the ambulatory is always going to be a little bit more personal, that warm handshake, the tap on the shoulder, that more personalized messaging from the actual institution. So, for example, here we will take the cath lab and emergent care. For the ambulatory side of the house, it's knowing what to do and where to go when you need immediate heart care can save your life. Schedule an appointment with your doctor or provider today to understand your heart risk factors and to learn about your cardiovascular care options. On the acute side, then, it kind of shifts the conversation to don't delay. When you need diagnostic or life-saving heart care, our cardiac specialists provide a holistic approach to care, offering a comprehensive plan for your long-term heart health needs. So you can see the sentiment is the same about receiving life-saving heart care, but the approach to this is based on the setting, based on what's important to the people who are attending that clinic or who are actually going to the emergency room, being sure to them in that way. Again, I'm not going to have time today to go through all of these, but you will receive these to kind of see some of those nuances. But as you can see, we've kind of made our way through all the way from the very beginning, strategic portion of this, down into the actual tactical piece of the calls to action, where we're going to drive these people to our online resources to pick up the telephone and call, or to simply go to a facility if you're experiencing a medical emergency. So I know we want to leave some time for question and answer. So just to sum it up, knowing your audience, which is the entire point of the mapping a patient journey, is honestly what we believe to be the most important piece of your patient acquisition strategy. It's not about how much money you can throw at it. It's not how pretty your resources are or how creative your ad set is. It truly is, are we meeting the needs of our patients, and are we doing it in a way that is backed by data and backed by our goals, that we're able to actually show movement on that and really get super targeted and use all of that together. The last thing I want to say, though, with that is it goes beyond this. This also allows us the opportunity. I don't know about for you all, but sometimes it was very difficult to break down some of the silos between the C-suite, between finance, between strategy, and between some of those service line leaders to really work together to make this work. So there are actually fringe benefits that come from doing this as well. Taking this framework forward and using this with your service line leaders, with your physicians, and asking them to help you out with that, to explain more in depth, to get you into the clinical know-how of how they're doing this day to day. Who's eligible? Why are they eligible? Who is their greatest, where do they have the greatest capacity? All of these different things really lead to collaboration and buy-in. Once you go to roll that marketing campaign out, these folks are already on board because you've taken them on the journey and allowed them to have the input where they should, which is in the patient care and in this patient journey mapping.
Thank you, Josh.
So,
okay,
yeah.
Go ahead.
Oh, I was just going to say, the last piece here is really, we also like to end with a centering quote, and it's, over every mountain there is a path, although it may not be seen from the valley. We also understand that it can be very difficult to do this on your own. We know that resources that are an all-time premium, that you may not have enough hands, you may not have enough time or even brain space to kind of walk through this. So I can say specifically, DECODE was my brain trust, really helped me organize my thoughts, take me through this. We've worked together to create this framework now, but at the time, it was great to have a partner that truly understood this and really was my resource where I needed them most, and really was able to provide me with those results and things I could take forward to prove the value of the efforts that we were doing.
Thanks, Josh. So right now, if y'all have any questions, please feel free to put them in the chat. We do have some questions from signups, so we'll start with those. The first one, Josh, we have is there any value in breaking down data into markets or zip codes?
Absolutely. I think that what we saw in the data earlier is really about being super, super targeted. Whatever information you have can be used to your advantage. When it comes to zip codes and really breaking it down by market, every market is going to have a very, very different need. We see different incidents of conditions and diagnoses from one market to the next. We may see access issues. We think about indigent populations that may not be able to travel for care, or that by us going into that market and doing a health fair is their one and only doctor visit for the year. They wouldn't know what their risk factors were or what they would need to go and be tested for, the questions to ask, as opposed to maybe another demographic that has full healthcare insurance and a doctor's office on every corner. So really understanding your market and applying those zip codes and your approach to that can be extremely important to reaching not just your volume goals, but also the mission goals that most of us have behind that as well.
And I think beyond just understanding the patients and the different markets, I think what you can do, and some things I would recommend looking at is building your service line strategy at the highest of levels first, and then narrowing down in terms of the nuance. And I think that goes both ways in terms of understanding the different demographics and nuances within the patient population in that service area, but also looking at it from a standpoint of different offerings, right? We walked you through a high-level CV patient journey, but you might be working for an academic medical center who has a lot of clinical trials or doing certain types of care where there's, having those conversations with strategy and finance and talking about what types of patients do we want to bring in within the CV. Obviously, you don't want just any CV patient. There are certain ones that are more valuable to the organization. And so I think it's twofold. And I think that is very important. But I say, an elephant gets eaten one bite at a time. So start bigger and then work your way down to those more local markets.
Great. Next question that we have is, and you touched on this earlier a little bit, but what impact does online reviews have in the consumer decision process? And how do you go about, getting more positive reviews?
Sure. So Kathleen, if you're okay with this, let's divide this one up. Yeah. I want to talk specifically to kind of getting some of those reviews. And if you would talk to maybe some of the more technical, maybe the SEO side and the importance of how we help patients write those and things. Number one, I think Kathleen and I would agree that this is probably a problem that people have had the world over. How do we get more without doing a grassroots effort and expecting those clinics to hand out the little cards that say, hey, give us a good review? How do we do that? I don't think that there is a right answer necessarily that's going to fit for everyone, but understanding your operational model and then finding a way to work this in. Now, follow-up communication with patients is essential. So patients that are having a good experience, especially, but also with your patient population, making sure that you're staying in contact with them between visits and after the visit to really encourage those good reviews is a super important part of that. If you're able to, at your clinic or at your hospital system, to be able to do something grassroots, have an iPad with a survey right there that redirects them to leave a review or to have a card with your your listing on that for Google or for Yelp or wherever you would like to push those people, that's a very important piece. I will say we did not see much pickup with that for ourselves in the health system just because there was very little consistency in that. However, the other piece of this I think that's super important is physician-generated content. Because when we really think about when people go to research or go to search for these advanced specialty care folks, having other ways of letting people get to know that provider or know more about them is super important. It shouldn't be just based on somebody else's opinion from a Google review. It shouldn't be just based on somebody's Yelp review as well. Having an intro video on a patient's, on a provider's profile so that people can understand what that provider is like. Having publications, if a physician has been published or is in news articles, making sure that those are available, that they are in your newsroom or that they're attached to a physician's Find a Doctor listing, those different types of things. And also social media. I think that, providing thought leadership opportunities for your advanced specialty care providers is super important from the perspective of people being able to go and see their presence online. Now, again, this isn't one size fits all. We understand that resources are different. Physician levels of comfort and participation in some of these things is very different. But what it does is it gives an additional avenue and opportunity for you to combat if there's potentially negative reviews or not a lot of positive reviews. It really allows you to show up in other ways that are going to be equally as impressive or as inspirational as some of the others.
Yeah. And I think, adding that from an SEO perspective and looking at it, and I think there's twofold, right? And I'm sure by a thumbs up on your reactions, if anybody's Find a Doctor data profiles are complete and you're 100% happy, I'd love to see a thumbs up so I can figure out what you're doing. Because there has been a problem that we've seen across the board with every system or physician enterprise group we've worked with. And I think, you look at Google, Yelp, things of that nature, and consumers are looking at that data. You do also have the opportunity with Press Ganey and things of that nature to integrate some of that information into your physician profile views that has a larger scale and therefore less sensitive to a bad apple, if you will, in terms of one grumpy patient who no one would have made happy. And so I think there are some things there that you need to look at in terms of implementing optimizations to the Find a Doctor profile views. But the other piece of this is the SEO play, right? And so leveraging schema within your physician profiles is extremely important. And then also when you're asking for those reviews, making sure they specify the physician name, the specialty or thing that they're being seen for, things of that nature, and the location help from an SEO perspective. Also by adding some of those things in and kind of helping them Mad Lib a bit on writing reviews, you're also opening up the opportunity for you to be able to easily take them down, because some of the things that you'll be asking them to do are things that then would be able to be removed. So those are just some considerations on how you can leverage Google and SEO and the review platform to actually increase your overall organic rankings beyond just a consumer platform for them to understand how a patient might, or how a physician might be from a patient perspective.
Very helpful. So we have 3 minutes left. If anybody has a question, please drop it in. Otherwise, we will end on this last one. So coordinated care is a significant aspect of our organization's services. Could you share some tips on how we can highlight this in our marketing?
Sure. So I mentioned earlier, really this idea of cross promotion. So again, the patient mapping or the journey mapping really allows us to be able to understand where that's appropriate. How do we really start to talk about that coordinated care instead of just saying on our About Us page or in our overview brochure? How do we actually bring that coordinated care to life and show those multidisciplinary teams, or where there's overlap and where our care teams are actually working together to provide that better care? So for example, if there are considerations for head and neck, and then into oncology, or from women's health over into oncology, really making sure that we understand those journeys, our internal journeys as well, that are going to mirror that patient experience, is really where we're able to then start putting things into an oncology exam room or into a primary care exam room for oncology, those different types of ways of really doing that. Again, it's living it out. It's making sure that those talking points are also out there, that we don't get so siloed in our piece of the journey or our one stepping stone. So it's also important to remind our internal audiences of what's available. A lot of times we get very bogged down, or I did in my past, got very bogged down into certain programs or services and would forget these connections, or forget that the people working in the day-to-day of it didn't know about what was going on over here. So making sure to keep that in front of people on both the internal perspective, but also then cross-promoting externally is super important. And again, I mentioned it can be anything from dual branded service line brochures to posters on the back of exam room doors, in the emergency department, other areas where we're really just connecting the dots for the patient and showing that coordinated care.
Yeah, and I think we're seeing a lot of this in the healthcare space as it pertains to oncology. So nutrition, mental health, things of that nature. And I think there's a huge, and rehabilitation and things of that nature. But I do think there's a huge opportunity, right? Anybody who's gone through a major chronic condition that requires advanced specialty care are going to have impacts on their overall health and how they have to interact with other types of services. And so helping a patient navigate that, which seems so simple, but, you know, I think back to my mom after her diagnosis with cancer and the importance of her, you know, where she could and could not receive IVs when she had to get follow-up care, certain issues that she had with her hearing loss due to a result of radiation and chemotherapy. And so I think helping the patient understand and navigate that survivorship or post-treatment, I think, is a big opportunity to not only build those relationships and goodwill, but also help with network integrity.
Great. Thank you so much. Okay. And with that, that will conclude our DECODE debrief for all of our attendees. Please look for an email coming later this week with all the resources, including this recording, so that you can go through this. And if you have any questions, please feel free to reach out to Kathleen or Josh with anything that you want to talk about, whether it's about this or a different topic.
Great. Thanks, everyone.
All right. Thank you, everyone.